Hey, it's Sebastian from Performance Place. We're in Orange County, California. If you're looking for some help on this, which is going to be sciatica. Sciatica is a common thing that people get, and we're going to talk about the local entrapment sites that you are probably aware of, or might not be aware of, which can entrap the nerve or the sciatic nerve or the parts of the sciatic nerve that contribute, or the nerves that contribute to the sciatic nerve anyways. And so, by the way, if you have not subscribed to our channel already, it's in your best interest to do so, especially if you're watching things like sciatica. I mean, go to our channel. There's a little circle. It's red. It's a little P. Go there and subscribe to the channel, and it'll actually you'll be able to go to a search bar. Search bar, just put in sciatica, back pain, piriformis syndrome, all the stuff that you're probably wondering about, and there's going to be a slew of videos that come up, and they're all free. Okay. But again, if you want some one-on-one help, we can certainly help you through this. Now, the common entrapment sites that we're going to talk about today, I'm going to use our model Bob Norman. And here he is. I tied him up with a little bit of a makeshift sciatic nerve, so I apologize if the anatomical accuracy is not there, but I'm gonna do the best I can because, by the way, no photographer today. So I'm gonna do the best on both ends. So the common entrapment sites that we usually talk to people about are, number one, is it could be irritated at the spinal aspect of it, okay? And so as you see, there's these little yellow nerves, there's one right there, that all kind of come out and they become the sciatic nerve. Imagine a bunch of little rivers becoming one big river. And so if you had pollution in the big river, it could be coming from one or many of the contributing rivers. And so that's the complicated thing a lot about this that I think that people see is they see the river, but they forget about where the river came from. And so the sciatic nerve does become the sciatic nerve right around this area here as it comes out of the pelvis. This is right around the area where the piriformis muscle is, right around there. And it goes under or between the piriformis muscle, or it's multiple heads of it in certain individuals. By the way, if you're wondering about piriformis syndrome, then that's on our channel too. So just go up and check. I have multiple videos on that. The common entrapment sites is, number one, it's going to be at the spine, and there's usually a couple aspects to that. I covered that in a different video, but I'll cover a little bit here. There's also too at the piriformis muscle, right around there, thumbnail, and then into the hamstring. All right, we're going to travel all the way down and go to the hamstring. So the hamstrings go basically kind of the same path of the sciatic nerve, and they attach up into this called the sit bone or the ischial tuberosity. And the sciatic nerve kind of actually, when in human dissection, is pretty darn big. And so the muscles come around here, and this kind of splits the difference between the two muscles as it comes from here, and they cross and they go to different sides of the knee. So this kind of passes right along the middle. And one fun thing that you can do actually, and I don't encourage you to do this on the side that you have pain on, is that say this side doesn't hurt, you can put your finger right behind your knee, just kind of put the tip of the finger right around there, and you're going to bring your toes up and stretch like you're stretching your hamstring, but use your toes to do so, and you'll feel something pop out right in there. That's your sciatic nerve. And if you go like this, notice how it goes away, and if you pop up, it comes back again. Okay? Notice we're not moving the knee, and we're not moving really anything above from the hip. We're obviously moving some of the muscles into here a little bit, but for the most part, the sciatic nerve travels between that, and on the sides you can actually feel, I'll show you again, you can feel the hamstring muscles. And so right around here, you'll feel the the tendons right around here. If you kind of take your foot, by the way, don't do this on the side, that's a problem. Dig your heel into the floor and you'll feel those muscles start to pop up on the side right there. Okay? In the middle is the sciatic nerve, and if you put your finger in there again, you'll notice it won't really pop up as much, all right? Now, if you're wondering where's your entrapment at, well, I can tell you with fair certainty, and this is based upon 12 years of clinical experience and spending tens of thousands of dollars on continuing education, most of you are going to be here. I'm going to say 90% plus are going to have it from a spinal aspect, whether it be from something weird in the spine, such as a tumor, and infection, or whatever, which is, again, fairly rare. Or it's going to be from nerve root impingement from IVF encroachment, or stenosis, or disc herniation, or whatever it might be. There's various reasons. Most of you are going to be up here. Now, the piriformis is the next spot where somebody might have the issue. If I'm going to guess here, God, Bob Norman keeps fighting me down at the little wheel, so it's a little hard to spin him. If I'm going to do a number here, I know my numbers aren't going to add up because I'm going to leave some percentages on the table. I'm going to say under 3% are piriformis syndrome, true piriformis syndrome. Well, some of you might say, nah, I think I got piriformis syndrome. This is the trouble with piriformis syndrome. Everybody thinks they have it, but most of them are up here. Okay, I can be pretty sure about that. I would gamble every penny I have that most of you are up here. I'd say 3% or less are going to be right here. But a lot of you are wondering, well, how do I know? Well, I did do a whole other video on this that you can go to on the corner. Just type up sciatica again in the channel. But I'll reiterate it a little bit here, is that just because you have tension in the piriformis has no merit on if you have piriformis syndrome. You can have tightness in the piriformis if you had a spinal aspect to it. It happens all the time, okay? So this has no merit. The tightness has no merit. The tissue work that you've done in the people who pressed into there, it doesn't matter how tight it feels, it has no merit on if it's piriformis syndrome or not. There's other tests that you can do, all right? The next is going to be the hamstrings. And the hamstring, again, these ones I've seen a little bit more frequently. Still not very high. I'm going to say under 5%. And so again, so the hamstrings, oh, this is going to be cool. We'll go like that. So the hamstrings kind of come through. And this is the sciatic nerve right there. This is the hamstrings coming down. Let's just say it attaches all the way to the knee. And so there are certain situations where we've seen there's a kind of a sticking point between the hamstrings and the sciatic nerve, like it doesn't want to slide. And the situations where this might happen in is if you've had a hamstring tear. And so if you've had a hamstring tear, you'd know it because there'd be a bruise there. Okay, this is one of the easiest ways to figure out if you've had a significant tear is if you had a bruise. If you're saying, well, I didn't have a bruise, then honestly, you probably didn't have a tear. But the hamstring hurts. I know, hamstring hurts. That doesn't mean anything either. It doesn't mean that your hamstring had a tear. It probably had a strain. Well, is a strain a tear? Not really. A strain is not a tear. It is a muscular injury, but it doesn't have tissue disruption, meaning your MRI will not be positive. Meaning, if an MRI is so good, it should see it, right? It doesn't see tissue disruption. Muscular soreness from working out can also be a muscular injury. It's painful. Doesn't have a tear either. There's no tissue disruption. And so this is a whole other conversation, but there's other reasons for having a strain, but some of it's nerve-based, some of it's reciprocal inhibition. Whole other topic. Now, I have seen people before with having the hamstring seemingly attached, not to attach to, but it kind of restricts the movement of the sciatic nerve. And doing something like a ball is not a bad idea in that case. But I'm going to show this as a demonstration, mainly because it's something I like people to do if they have that entrapment. But if you had another entrapment, like your 90% plusers, is a big waste of time. It might feel painful, and it might feel like it's helping for about an hour or two, but it's not going to stick. So here's what we have. Again, I apologize for camera angles. No cameraman today. So I'm going to take this and I'm going to go underneath here, and I'm going to put some pressure on it, and I'm going to move back and forth a little bit till I find an area that's tender. It should not send pain to my foot. If it does, then you're on a nerve and get off of it. Okay? And so usually I like to kind of find a spot that's tender, and I don't use my toes up. I just kind of start kicking a little bit like through the ankle, not the toes. And I can put a little bit more pressure onto it. Again, it might feel like a toothache. You can get a little bit higher too, right around here. By the way, it's pretty important to note, well, I feel it tied up in my sit bone, right up in there. Do you think it's from the hamstring entrapping the sciatic nerve? Nope, that doesn't mean anything either. Tenderness to touch really doesn't have a big merit on where your entrapment is. It comes down to orthopedics testing and doing specific testing around the area. Okay, and so I mean that in the nicest way. I know I've had areas that feel like it's the area. I feel like it's the muscle too, and it's not. A lot of times it's just referred. Referred pain can feel as much as a strain as a muscle tear can. But again, did it bruise? No. Then it's probably going to be from the spine or poor stabilization somewhere. Now, can it be entrapped below the knee? I guess so. I've heard of a couple situations that have been like into the calf area or it creates trigger points in the area too. I wouldn't put any weight in that either. And so if you're chasing sciatica pain below the knee, you're doing yourself a big disservice, and I think you could do something that's a little bit more high percentage of outcome, which is going to be a little bit higher into the hip area or into the low back. So you're probably wondering, what do you do if it's in the high percentage area like the low back? Well, I did do a whole other video on this. We did the hook line position, like laying on your back, but I can show you different variations of things too. And so keep in mind that I'm just showing one, okay? There's other different types of remedies that will work for people, and I would love to say that everybody has the exact same solution, but they don't. One person's medication is going to be someone else's poison. And so it will feel very bad if you did this and if it was the wrong thing for you, but this is why you need to be checked out by a medical professional, okay? Let's see if we can get the camera angled. It's looking pretty good, huh? You guys are here for a video, so you want to make sure to see a video. Okay, so a lot of times when people have sciatica or leg pain without having back pain, this might be something they can pick, especially if they're older. If they're over the age of 60, 70, and they've been screened out for things like malignancies, this is something that's a good, easy pick. And so let's say this is the side of complaint. I just have them take their hand behind their thigh and start pulling their knee up to their chest. Again, does this make it shoot to the leg after about 5 reps? I hope not. If it does, then we back off and we pick something else. But for the sake of this video, I'm going to pick this one as the thing that's helpful. We've done a lot of other videos on stretches and exercises to do for sciatica. Again, you can go to the channel link somewhere in the corner. It's a little red circle, okay? But I usually have people do about 10 reps here, and I challenge you to try this. If you're willing to try it, go ahead and try it. And then I have them sit here and feel about, what do you feel like? And they say, oh, it's a little better. Okay, good. We're going to do 10 more. Pull it up to the armpit. Pull it up to the armpit, okay? As long as this takes it out of the leg and especially above the knee, then this is a good thing, okay? You do 10 more and you think, oh, it's a lot better. And so we just have them keep doing it, all right? That's something that's helpful for multiple reasons. One reason is that if this was primarily from the nerve being entrapped within the little hole, the intervertebral foramen, then it opens the hole a little bit. Also, too, it helps out loosen up the hip if the hip's a consideration. Many times the hips are very much related. This whole area, I guess I'll bring Bob Norman back over, get situated back up. I need a professional videographer to come around everywhere and do these videos with me. So the hip and the low back is a very intimate relationship, all right? If you have low back pain, you're going to have hip pain probably. If you have hip pain, you're probably going to have low back pain. If you're wondering why your back pain's not going away and there's no positive MRI with it, then you should probably look at the hips a little bit too. Not that you'll find things like arthritis and weird big things with it, but a lot of times the hips just don't function extremely well if you're having ongoing things. Something's creating this, something's driving this problem. Again, dumb analogy, if I'm at the beach, I'm in the sand and I dig a hole and I come back and there's more sand in the hole, someone filled it up. Whether it be another person or the waves brought sand in, there's more sand in there. So the problem is, stop that, and the hole will stay there. And so that's what we want with sciatica. We want to keep pressure off of the nerve. Now, sciatica, it's probably important to note with this, as I should have mentioned a little bit earlier, is that there are certain situations where sciatica is something that needs to be addressed very quickly. And we call these the red flags of back pain. Or you can probably look at the red flags of sciatica. Just Google that. It's very public information, and that's something that you need a little bit more urgency of getting everything done. But really, sciatica pain is not an indication that there needs to be any surgery done. It comes down to function. Does your foot work? Do your bowel and bladder work? You know, things like that. It comes down to function. And so when we test people here in our clinic in Huntington Beach, we test all that stuff out. If they need an MRI or an X-ray, we'll tell them, but most of the time they don't, because within a short period of time, they're feeling much better just as they are with that little thing that we did. All we're looking for is a working diagnosis, not an exact, because you'll never find an exact. No clinician will ever find an exact diagnosis on the first day. No one's ever 100% sure. You pick a working diagnosis. That's what we learn in school. You pick off that big list that we see in Google, and we're like, okay, it's not a cancer. It's not, like a broken nail. It's not this. And so we just kind of narrow the list and we look at the best probability, and that's all we look for, all right? It usually comes down to taking a very thorough history, and that's you communicating with us and telling us what bothers you, what makes it feel better, what you've tried, worse, what time of day, and so on. That's all very helpful to us, helps us solve the problem, or at least find a direction to solve the problem. The second thing is a good physical examination. A good physical examination usually takes about 15-20 minutes with somebody who's really skilled, and you just go through all the good tests. I apologize, sniffles. But we can figure out a working diagnosis from that. And a lot of times, people are more satisfied if they just trust that that's the right path to take and they try something like the thing that I mentioned earlier. And they're better than they ever thought possible and sooner than they ever thought possible. Going down the route of having the exact diagnosis and looking at all the images and so on and seeing all this, I mean, nothing wrong with seeing specialists and getting second opinions, but if you do all that stuff, sometimes you lose more money in that process and lose more time where it's harder to reverse. So I always suggest picking something that's high reward, low risk. A lot of times doing things like good rehabilitation is useful. There's things that work better for certain people than others, but a lot of times movement-based medication is extremely helpful, and finding someone who's very good at it is useful. Again, I'm not against surgery, medications, and injections. I've sent people for them personally, but it all depends on what's the goal. All right, we had people who are non-responsive to our type of care for sciatica. And we need someone to co-manage and help us with that, and so that's totally fine. But to take that as an initial first jump, usually we don't need people to do that because we see that they can succeed so much quicker. So if you guys are looking for more help on this, you can always reach out to us. We're at Performance Place Sports Care, again, Orange County, California, not Florida. Our link is below. Our phone number is 714-502-4243, or just email us info@p2sportscare.com. We also have a free gift for you. We've been trying to make free gifts for everybody who watches these videos, mainly in regards to if you tried that thing and it helped you, or you feel like you want to know what's next, what does Sebastian have next for me? Get that. Get the little guides. Like we try to really answer everybody's questions on YouTube, but it's not very good for communication back and forth. For whatever reason, we don't get alerts when people respond back to us, and we feel like we're just leaving them hanging. And so to continue down the route of this topic of leg pain, just get what we're talking about. It's going to be in a little corner over there. It'll pop up, or there's going to be something way down at the bottom in the description. So just scroll down until you see that. It's going to be a link down there. But there is no substitute for one-on-one attention. If you need help, just say so. People suffer with this thing way too long, and it's harder to get better the longer you've had it, the more incidences and flare-ups you've had it. So if you need help, just tell us, all right? If we don't know that we can help you and we need to send you somewhere else, we'll tell you that too, okay? I think all you can expect from us is an honest answer about if we feel comfortable working with your case or not. So if you're in Orange County, we can do so. We also offer telehealth as well. And so we can help you in many different ways. We don't always need to put our hands on you to touch you. As you can see, something like that, very helpful for a lot of you. So reach out. We'd love to help you out in any way that we can. Subscribe, like, and share. See you next time.